Hello, Vaibhav.
Hello,
Congratulations
sir.
first. You must be really feeling great. It's a top of the world feeling to know that you have scored the top rank in the country in one of the most sought after specialities. So let me be one of the first few people to congratulate you. Congrats, and enjoy your moment.
Thanks a
So
lot,
tell
sir.
us a little about yourself.
Sir, I've done my undergraduation from Maulana Azhar Medical College in Delhi and my post-graduation from University College of Medical Sciences in GTP Hospital in Delhi, sir. Sir, I passed out
Okay.
in 2023 and sir, then I had done around 2 years of SRship till now. And now I've cleared the exam finally, sir.
Great, great. So when did you finish your post graduation? How many years ago was it?
Sir, it was in June 2023, sir.
Okay, so a couple of years back. So
Yes, sir.
really, you've been through the grind and you've been working really hard, and
Yes,
finally
sir.
the efforts are showing now.
Definitely.
Great, great. So tell us a little about your journey and why you wanted to take up surgical oncology.
So, surgical the field has always like really intrigued me about because the diagnosis of cancer makes person be very uncertain about his future, makes a lot of anxiety around everything, and that's always motivated me to at least help in some way or the other. And from my PG residency days also, sir, I had a lot of exposure in oncology in my unit and used to discuss oncology cases with the med onco team also. So my interest gradually developed in that, and I guess during the my university exams, I decided that I will be pursuing surgical oncology as a specialty. So I just started preparing after my MS exams only, sir. And sir, I couldn't write a couple of attempts in between due to some personal reasons, but then I really brushed up my preparation in these last 6 7 months, and so did write both NEET SS and this INI SS. And I'm very happy to get a rank finally, sir. The college which I was chasing now finally able to get.
That's great. That's great, Vaibhav. It's really an inspiring journey. See, some people they get it in their, like first shot. Last interviews I did in NEET and all, many people had gotten through right in their first attempt. And for some it works like that. For some it's a little longer journey, as it is in your case. It doesn't matter. Ultimately, you need to get the course that you wanted to always do. Though each course, I always keep telling that each course is equally significant and equally good. It depends on whether you like it or not. So
Yes,
that
sir.
way, you have succeeded in your journey. So, which part of surgical oncology are you sort of like more interested in? Is there any subspecialty that you're interested in, or is it like you like being able to do head to foot in oncology?
Sir, nothing. Sir, main interests are in sir GI oncology and breast oncology, but sir, every part of oncology really interests me a lot. Even if the other portions apart from surgical, I have always been very interested in all these things. Uh,
Great, Vaibhav. That's really good. So you're more into the generalist mode right now. It may change, when you finish your course, you may be sort of thinking about getting into some kind of subspecialty
yes,
as
sir.
well.
But
So hey, you still have a long way ahead. You just enjoy your moment now. Don't think about the course even. Just think that yes, finally I've achieved it. And you're top of the world, you're top of the country now. So you can definitely think that yes, I've done well. I've gotten what I wanted and relax a bit and enjoy some and take a breather before you join. So tell us how we at DocTutorials were able to help you in your journey.
yes, sir. Initially, I was a person who would just go by the books and like really had the used to enjoy reading books. But sir, ultimately, I realized that if you are going to crack exam, then you have to go how the examination is being taken and how the questions are being asked. And Dr. Rules has been a great platform. They have already done the hard work for us, and we just really need to follow what the teachers are doing there, telling us that the QBank has been very good, sir. I had given a lot of tests in the last 2 3 months. Initially, I was not giving so many tests, but after giving the GTs and a lot of topic-specific tests that really brushed up my preparations, and I got to know which areas are my weak points, and I really worked on them, sir. And also, sir, the faculty is, especially sir, for oncology, I only know because I was just following for oncology part, sir. So I just want to mention that, sir, you have been very passionate and great teacher regarding oncology, and some of the things I was not exposed to, like gynae oncology and other things, I really got to know about those after watching your videos, both on the app and on the YouTube, sir. So that was very inspiring for me also, and that really helped me in my preparation, sir.
Thank you so much. But as I always tell all the people who get through, it is your effort first. This is your moment, and it's predominantly, I feel, at least 80-90% is the student's effort that comes in. The last 5 to
Yes,
10% we just help along, and we are like ladders, or what you can say, the matchstick that lights the lamp. That's the kind of thing that I always say, because it's you need that little bit of a spark to get you going. That's all is needed. It is all there in you already to raise the kindling and make you go great. So congrats once more, and tell us a little about the people who have helped you in your journey, and anybody special you wish to thank.
sir, I think there were a lot of people I won't, sir, especially my late father, sir. I would like to dedicate this to him, and then to my mother and my sisters, and sir, there are a lot of friends. Like naming a few will be an injustice to the great support I have with my friends. I'll just especially like to mention two of my seniors who have been very helpful in my journey, sir. Dr. Akshan and Dr. Chinmay. They have like really guided me along the way and helped me not only in oncology pursuing this thing in other decisions of life as well. So really a really great thanks to them also, sir. Because sometimes it's just not about preparing exam. You have to keep look. You have to manage other things also besides, and so you need some mentors in your life, sir. That's how you navigate through all these topics, sir. So there are a lot of people, sir, but I just there will injustice to just mention some of them, sir.
So it's a great way to thank the people in your life. Good,
Yeah.
good, good. See, as you say, mentors in life are very important. All of us have them, even at this stage in your career, or even when you are probably till probably the fag end of your career. Till that point, you will always have some people you look up to and who will guide you in. Let it be surgery, let it be the finer aspects of managing patients, or generally how to manage your, your professional life. So many kind of mentors are there. They will play a special role in your life. Always, and that is going to help. So, a word of advice for your juniors and other, younger colleagues, or even colleagues that you may have right now who are still preparing for their exams. So, how would you actually break it down and advise them to study? How do you focus, and what would be your advice?
I think the first thing would be to have a clarity of goal in your mind that is as to what you want to pursue. You should have an exact idea of what you want to see yourself after next 5 years. So after you have set that goal, then you start working towards it. Firstly, sir, the race for everyone is different, sir. You would not look to others what others are doing. You have to run your own race. So let's just try to make yourself better day after day. Then, sir, to the specifics of what subject you're preparing, just try to get what is the best available material available for you to prepare for that. And so most of my seniors have suggested, most of them were using DocTutorials only, so that I got to know about it. So that now that yes, it feels good to study something from a book to read it in detail, but sir, you also have to prepare it in examination mode also, because ultimately you have to write an exam to go to a higher level. So you have to go to the specifics, do the questions regularly, sir. GTs are very helpful, sir. Regardless of at what stage of preparation you are, you have to give regular GTs. It is a reflection of what you are doing. Are you on the right track or not? And then, sir, just like keep motivating yourself. That so there will be a point that you will be in the there will be a lot of setbacks, and just you have to keep going. Just don't stray away from your goals. It might take a bit longer, but then ultimately, if you are onto it, you will get onto it. And sir, I would just like to mention the mock interviews that you conducted before the exams of INI. Sir, I attended two of them last year and this one also. So these are very helpful. So just the way you and Dr. Senthilwalli discussed all the questions, that was very helpful, and just I got to see what I have to brush up a little things about the topics you have asked. Those sessions were very helpful. Thank you, sir.
Thank you again, doctor. So, congrats once more. So,
Thank you.
essentially, I would say keep up your good work and keep
Yes, sir.
following your passion. That is very important. Like,
Definitely.
no, like everybody, all of us will have one area of interest. Focus on that. The journey may be a little longer, but only if you sustain that interest in the long run, only then we can keep up, because our field as a whole is a very difficult field. I'm not just talking about oncology. Medicine, I'm saying, is a very difficult field in which you need to sustain the interest, and you need some passion for you to follow. And you may have friends or other fields or other colleagues and in schoolmates and everybody who's making a lot more money, or achieve greater success in a far shorter period of time. But I'll tell you something: the happiness of treating a patient and seeing them
Exactly.
get cured, is something unmatchable. I don't think you can actually, you would have already experienced it as a surgeon, as a, as an MBBS graduate as well. So that feeling is unmatchable, and that is something that we should all be proud of and be happy about. So congrats once more on your great journey. And, as you said, start preparing subject by subject, go through the videos, get the grant test, put yourself in place, and then start doing it, and have some partners as well. So that will help, as you said, seniors, your colleagues, everybody who work with you, they will all help, and that is the great way to go ahead. So congrats once more, Vaibhav, and thank you so much for taking out your time and joining us today. And all the best. Savor this moment. Just go and spend some time with your family. Enjoy this moment. Your mother should be looking forward to be with you for some time, because you still have a long way to go. But savor this moment, because this moment is yours.
Thank you, sir.
Congrats once more. Thank you.